action for sale. Okay. Excellent.
Yeah, no.
Okay, well, welcome everybody to our September quarterly meeting. Before we get started, we have some folks in the room and then maybe a couple of people online who this is like your first time doing anything connected to the Alliance. So I just wanted to give a quick 30,000 foot view of like the Alliance and like who we are and what we do. Oh, my name is Jen. I'm one of the staff to the Alliance, and this is Christina, our other staff person, and Craig, our co-chair for the Alliance. And so, okay, I said 30,000 foot view. So the Alliance, we are an advisory group to the Oregon Health Authority, OHA, and we advise and monitor and provide like just feedback and guidance on our state's 5-year youth suicide intervention and prevention plan, also known as the YSIPP, which we're going to be digging into a lot in the second half of our meeting today. And yeah, so that's pretty much like 30,000 foot view. That's what we do. We also really work to kind of connect the field is another one of our goals, just to be able to kind of serve as that middle group between like folks doing the work on the ground and then our state agencies, just to pass over and provide like recommendations and feedback, and just other things that we think are important for the state, our state partners at OHA and also Oregon Department of Education to know about like kind of like what's going on in the field and how we can better support and provide resources for folks in our communities. So 30,000 foot view. If you'd like to know more and would like to get connected more, feel free to let me know. And we have a sign-in sheet. Sweet sign-in sheet being passed around for our in the room folks. And then just some quick housekeeping things because we are hybrid. For the folks in the room. So we have these two capsule looking things called owls, and that's where our cameras are coming through for people online and then also our speakers. And so crosstalk will make it really tricky and difficult for folks online to be able to hear what's going on in the room. So if we can do our best just to have kind of like one human speaking at a time, that would be fantastic. It does feel like we're being watched, Justin. I know that you all are seeing the side of my face, so I apologize. I will try and look at you all, but it feels weird talking to a robot. It feels very strange. That's true. I can be talking to Jill, and then, but really, yes. Okay.
Also a robot.
Also a robot. Yes. So that will be that piece. There's restrooms out that door, those ways. Right. Go one way, that way. And then also for folks in person, there's lunch that will be provided afterwards. Sorry, online folks, you have to figure out your own food. But for in person, there will be a bag lunch upstairs somewhere. Don't pay for lunch like I did for breakfast. There's free food, so don't do that. I didn't know that there's
from 12 to 1.
12 to 1. Okay.
They can grab.
Okay, yes, because we end at 12:30. So if you wanted to go up and like grab something, you could always bring it back, or you could wait until our meeting's over and then go get it. And I think that's it for housekeeping. Any housekeeping things that I'm missing? Okay, and then online, Chris is changed name to tech support Chris by Folco. So thank you so much, Chris. If you have any questions, private messages, don't send those to me because they won't be private. They will be displayed on the screen for all to see. So if you have any questions or concerns, please send those over to Chris, tech support, and Chris will be able to help with that. And I think that's it. So now I'll pass it to Craig.
Hi there, good morning everyone. For those who I do not know, my name is Craig Leitz. I use he and him pronouns, and I serve as the vice chair of the Alliance. We're so excited that there are people in the room today. Also, it's really weird. Those of you who are virtual are behind me and I can't see your wonderful faces. So I will try and be okay with that, but it's not my favorite, letting everyone know now. We are, excited to have you at this quarterly meeting. Thank you so much to Jen who gave us an overview of the Alliance. If you want more information online, you can throw your email in the chat, but the sign-in sheet here also allowed you to let us know if you wanted more information about the Alliance. In our last quarterly meeting that some of you attended, we had a presentation about 988 and the current communications campaign. Hopefully many of you across the state have seen 988 communications. I've heard radio ads, I've seen commercials, I've seen lots of billboards. So it's reaching me. I'm also paying attention because I know what 988 is. I hope others are also seeing these things and paying attention as well. And then OHA also gave us a presentation on data at the last quarterly meeting. If you were not at the quarterly meeting and you're interested in seeing what happened at that meeting, the recordings are on the Alliance website. So you can go and check that out if you weren't able to make that meeting. Next slide, I think. So here is our agenda for today. We sent this out before we started. These are Jen's adorable littles. So enjoy the picture. These are the things that we're going to talk through. We'll have some Alliance business that we'll go through. We also have a presentation on cannabis use and teens and how that relates to suicide, and so relevant to the work that we do. We'll also learn more about the findings of the annual Alliance survey. We'll have a break. Then we'll talk through policy recommendations. Maybe I messed up where the break will be, but we'll talk about policy recommendations for OHA. As Jen said, the Alliance provides, we're an advisory to OHA, and we recommend to them what policy priorities should be for the next legislative session. And then we will also talk through the YSIPP and what's a preview of that and a fun activity. So look forward to that.
What's the YSIPP?
The YSIPP, the Youth Suicide Intervention and Prevention Plan. I got it right. Thank you, Jill. It's a test and I passed, I hope. So this is what we'll do today. Take care of yourselves, both in the room and virtually. It's a long meeting, but we're really excited you're here.
And really quickly, I think I just wanted to note a staff change and just to thank you to Chris. So Chris Feifulko was with AOCMHP, who Lucina, Tim, Maria, and I are staff. We work for that, and then we're contracted to the Alliance. And Chris was a staff person to the Alliance and did just a lot of amazing work with AOCMHP over the last 5 years. We started around the same time, so like 5.5 years ish. And Chris is now transitioned to work with Multnomah County. So while we really just appreciated all of Chris's time and work with the Alliance and just did a lot of great stuff. And now just our staff has just made another transition and a switch. So I just wanted to quickly mention that and just say thank you to Chris for everything. And like Chris has said, like they're just in a different position, but they'll still plug in when and where they can. So just wanted to thank Chris for that.
All right, so we are going to get started with some breakout rooms virtually. We are here collectively in the room. We will do a different process, but we want to give you all the opportunity to get to know each other. So we are going to take the next.
We can actually do 7 minutes. We're actually on time. That's weird.
Okay.
So we can do 7 minutes in the breakout rooms.
Awesome. So we're going to spend 7 minutes in breakout rooms. Chris is going to facilitate those virtually for us. We're hoping that you will share your name, your pronouns if you're comfortable, where you work, what you do, how your affiliation, what brings you to the Alliance, and then what is your favorite fall time tradition that you're looking forward to? I know for some of us across the state, it's still very hot and may not feel like fall, but hopefully it will be here soon. So what is your favorite fall time tradition you are looking forward to? And I think Chris will open the rooms when ready.
Yeah. And I'll mute us. Chris will still be here, so if you need anything, but I'll mute us. That way you don't hear like the chatter going on in the background.
Ready for me to close the breakout room?
Yeah, sounds good. Thank you.
It's going to give a 60-second notice to everyone.
Yeah, that sounds good. I could not find the thing, the language that like Justin and Kelly have shared with us around like the voting thing and like if there's no dissent. So I just moved my assignment before March, we talked about this so on, so my assignment before March is to get a thing for us. I'm trying to meet with Kelly and or Justin to figure that out.
That's great.
And I don't know how close we have to be to Robert's rule, like, do we have to follow those religious, no, okay, cool. Sweet. I think it's make a concept.
It's a tool, not a rule.
Robert's too.
No.
Sorry.
Next on the agenda is a rap.
It's funny, I used to do a scat rap for a previous job.
Oh.
Mhm. Yeah.
How is this the?
Yeah, it starts with an S and it ends with a T. Comes out T, comes out. It's like ingrained in my brain.
Okay, I think we're all back now.
Cool, glad that you bring that.
Yep.
I think all the breakout rooms are closed. We've learned a little bit more about Jen. All right, so we can go to the next slide. So we have a collection of business items that we have to get through. Just as a reminder, I think we'll share an update on who is existing members. Those are people who can vote as we're going through various things today. We'll also talk about our June quarterly meeting minutes and make sure that those looked good for everyone. We'll talk about a couple other things as well, but I think we can go on to the next slide. So just as a reminder, these are folks who are existing appointed members of the Alliance. These are folks who we'll seek votes from as we're moving through today. We're so thankful to everyone else who is here, who joins us. A lot of our work is done by a variety of folks and not just folks who are voting or appointed members. Our subcommittees are benefit from folks who are not appointed members. If you are someone who is interested in being an appointed member, please reach out to Jen or Lucina, myself, to learn more about that. Our bylaws do state that only one person per organization is able to be an appointed member. So if you see someone on this list from your organization, you can check in with them about ways to have them represent your views with the Alliance. But if there are any questions about membership, Jen and Lucina are good people to go to.
Can I say something here?
Yeah.
For hot off the press, breaking news, is that at the last executive subcommittee meeting, the executive subcommittee put forth recommendations for with some folks that applied newly to the Alliance. And some that of this list that we're applying again, that their time is expiring at the end of September, so they are still in their time of service, but are applying for reapplication. And so because the OHA director has to be the one to appoint who is members and who is not, we got confirmation that those on the list that fit 7 legislative mandates for roles. And I'll find the list of names of those people, are appointed to a 3-year term from that list of recommendations. So and those who are not filling legislatively required roles and are asking to be reappointed, that decision just got separated from it, so that's pending still. But we'll have an answer by the end of September. So if you're a member of the Alliance, you get a letter from OHA saying, congratulations, you've been appointed to be a member of the Alliance. Here are the expectations and here are the rules for being a member of the Alliance. And so if you applied for a membership either newly or as being reappointed, please watch out for that letter and notice by the end of September. That's it.
Awesome, okay, thank you. We are just doing one thing really quick. We are seeing that we have enough members here to reach quorum for votes that we might do for the rest of the day. So give us just 1 second to do that. As we are moving, we will move on to approving the minutes in a minute. That was sent out to the Alliance listserv prior to this meeting, so if you wanna pull those up while we're waiting to make sure that all looks good, we'll move on to reviewing those minutes in just a moment.
Do we need to round up? Or can we not? Because if we don't have to round up, we're at quorum. If we do, we're at quorum.
Great, we have quorum and are able to vote moving forward, wonderful.
Sorry, just 1 second, I need to make one adjustment.
I hate that I'm using this person doing that.
Yep, alright.
Okay, awesome. So just as a reminder, this is how we have to vote per our bylaws. That there needs to be a quorum, which is 50% plus one person. And must include either the chair or the vice chair. I am here, so we will do good for that. And we have, yes, 16 members present plus myself, so we are able to vote. And we will remind everyone before we vote each time what the process is. So an appointed member makes a motion, then we have to have a second, another appointed member who will do a second. And then in the chat, the full alliance will vote. I think there are a handful of us in the room who are voting members who can vote verbally. We'll track that down. But for folks who are in virtual space, please vote in the chat. Yay means you agree, nay is in opposition, and abstain, you are neutral or not voting formally one way or the other for that motion. Great.
That would just be a motion for the minute. Susie.
I just want to make sure my name's on this list, but I have not received my letter. So am I officially a voting member right now, or am I not a voting member right now?
You are, the email just came through like this week, so it's gonna take like a couple of weeks probably for your letter to get to you, but yes, you are officially a member, you've been appointed.
Okay, thank you. Just wanted to make sure that I knew what I was supposed to say. Thanks.
Appreciate that, thank you, Susan.
And there's no slide about the minutes specifically.
No,
So-
yeah, it's just asking for a motion, if somebody would like to make a motion for it to pass or not.
I move that we approve the minutes from June's meeting.
Okay, awesome. Thank you, Jill, for moving to approve the minutes from the June quarterly meeting. Do we have a second?
Sorry.
Okay, thanks, Gordon, for seconding that motion. All in favor? Say yay. Yay. Awesome.
Yay.
All opposed? Wonderful. And yeah, for folks virtually, you can put that in the chat. I see chats coming through. Any opposed can put nay, and then abstains as well. The minutes have passed. Awesome. Wonderful. Okay, and then we just wanted to remind you all that we have one more quarterly meeting that will happen in December of this year, and then we will have our quarterly meetings next year as well. We ask everyone registers on Zoom for those meetings, so if you have not yet registered for the December meeting, you can do that at the link shown. Also, it's on the Alliance website, and then you can also pre-register for the 2026 meetings if you want to be on top of things and get those onto your calendar. So please make sure to do that.
And the only thing about the 2026 one is there's a chance that the September 1 date may also be changed like it was this year, depending upon if we line it up with the summit again and like when the summit happens. So just keep your eye out for that. And if it does change, the thing with Zoom is funky, so you just have to re-accept like the new invite to make sure that the calendar moves to the correct day. but I'll send out a reminder if that happens again next year, but just wanted to throw that caveat out there. Oh, thank you. Yep.
Okay, wonderful. So,
There's no sign for that. I didn't do that. So.
okay, awesome. Wonderful. So one of the other things that we wanted to mention is that Annette Marcus, who is here in the room, who used to be staff for the Alliance, who we miss terribly, as well as Linda Hockman, who is virtually with us. When Annette was with the Alliance, they created a presenter guide, which was a recommendation for folks who were presenting to the Alliance on things like, safe messaging around their content and other tips for presenting to us. That is something that we will share following the meeting virtually. The executive subcommittee voted and approved that document. However, we also want the equity subcommittee to look at that document. So for all folks on the listserv, you'll be able to see that following the meeting. It will go out with the meeting materials, but it's still somewhat in final review by the equity subcommittee, but had been voted on by the executive subcommittee. Didn't know if there are any questions about that. Anyone? I know Linda is here, wanted to say anything more. Awesome. We also want to let you know that our executive subcommittee is the only subcommittee that has folks who are appointed and then are voted into positions. We do have some openings on the executive subcommittee. We're looking to fill an at-large position. I previously was in that position, but since I moved into the vice chair role, that is currently open. We also have a position available for a youth or young adult member who is someone 24 or younger. We are always excited to get youth and young adult members onto the Alliance generally. So if you know a youth or young adult who might want to be on the Alliance, please let Jen and Lucina know, and so we can support them in becoming a member. We also are in search of 2 folks who are people with lived experience, whether that's their own direct lived experience or lived experience as a lost survivor. What will happen next is we will seek nominations for those positions. You are welcome, if you are an appointed member, to nominate yourself, or you can nominate someone else. And then once we go through those nominations, we will do a vote at the executive subcommittee to have those folks join that subcommittee. Feel free to put your name in the chat now if you're interested, or you can reach out to Jen. Yeah. And if you have any questions about what it means to be in those roles or to be on the executive subcommittee, you can let us know. That's fair. We'll hand it over to you.
So all of our subcommittees, anything connected to the Alliance is open to, well, all of our subcommittees and our meetings are open to the Alliance. So anybody can attend them, and the majority of our work is moved forward like in our subcommittees. As we've kind of talked about already, like only our OHA appointed members can vote, but like anybody can engage like in the discussions and the work that's taking place. So we just wanted to go over what those subcommittees are really quick, just to let you know when they're meeting, because a handful of them have changed our meeting dates and times. And then just kind of remind folks of the open invitation to attend when your schedule allows. We'd love to have you join when able. So Craig will talk about exec first, and then we'll go through, and this is not at all like to talk about all of the work that's being done. It's just a taste to get you interested and leave you wanting more so you can join us.
Mm-hmm. Yeah, and as Jen said, those are open for anyone to attend. These are all public meetings, and non-appointed members are certainly invited to get involved with subcommittees. That's where a lot of the work happens of the Alliance. So the executive subcommittee is meeting monthly now on the second Tuesday of the month from 10 to 11:30 in the morning. Again, we have some positions open, so we hope you might consider that if you're an appointed member. And then, as I said, they're public, so anyone can join. And that the work of the executive subcommittee is to help lead the Alliance, to discuss the policy that we do, membership, and then the direction of our work.
Data and eval meets quarterly, the same months that our quarterly meetings happen for the full Alliance. So the first Thursday of March, June, September, December from 9:30 to 11. And they're currently looking at making a logic model like for the Alliance's work overall. And then they also provide feedback on the annual YSIPP reports to OHA, the Youth Suicide Intervention and Prevention Plans to Oregon Health Authority. And then Our Lethal Means meets monthly, the second Wednesday from 1 to 2:15. It's our only meeting that has non-90 minutes, so it's we're special with Lethal Means. And we currently are gathering information from those 18 to 24 on some safe storage, so that way we can provide recommendations to the Oregon Health Authority on safe storage, not just for firearms, but also for medications and other and substances and just other things. So just the big safe storage conversation. And then we're really looking at the second and third lethal means use in attempts and deaths to provide recommendations to OHA. And then we're also going to be taking a deeper dive into teen cannabis use, which we're going to touch on today with a presentation from Lee. So that's lethal means.
The school subcommittee meets monthly also on the third Wednesday of the month from 8:30 a.m. to 10 a.m. And it's a very lively group. It's well attended. There are folks from all different roles within schools and districts and education service districts. And we are, one of the main things that we're tasked with is kind of monitoring the implementation of Aggie's Act across the state. So I really welcome folks to come. It's an exciting group. And there's people who are on the ground with students all the way up to the state level, really coming together to make recommendations and to share out resources and programming that's working. So yeah, come join us.
And then we have our transitions of care, which meets monthly the second Thursday from 1 to 2:30. And we're currently embarking on a pretty big project to kind of do a scan on transition concerns for those 18 to 24 that will also help to shape some recommendations for Oregon Health Authority. So we're starting just in like the information gathering stage to hear from experts and people doing the work on what they see kind of in their field. And that's what we're starting with. And then last of the subcommittees is workforce, so they meet the first Friday from 9:30 to 11, and they're really focused on making sure that we have an equipped workforce, not just in the behavioral health field, but just across different workforces, so people can like find the right help at the right time. And then equity is actually our final one. I'm used to doing alphabetical order, but we're doing equity, and I'm gonna pass it to Mary Ann to talk really quickly about equity.
Mary Ann said they had to leave from 10 to 11, but they'll be back.
Okay, I will talk about equity.
Yeah.
So the Alliance Equity Subcommittee has a new time. We're gonna be meeting a fourth Tuesday of the month from 9 to 10:30. And it's an exciting time for that subcommittee because the new, the next 5-year iteration of the YSIPP has really given the equity subcommittee the space to start helping to shape some of the cultural infusion pieces of the work that we do within the Alliance, and also to help kind of the Alliance itself be a more equitable space. And so we're starting to think about what that looks like and how we're going to do that as a group, and develop a work plan for that work. So it's an exciting time to join, really get to help shape it. And just as a part of that group, our group wanted to really say that at this moment in time, there are a lot of our community members who are experiencing higher stress, higher feelings and experiences of oppression, and we know that that is linked to suicidality. And so we really want to be centering folks from those communities and making sure that our suicide prevention efforts are really impacting all of our state members. So it's a great time to come and join and be a part of creating what that work is gonna look like. And then we also have the WAP group, which is not a subcommittee. It's the White Accountability and Learning Community. We have a new meeting time also, which is the first Thursday of the month from 9:30 to 11. And this is a group of folks who present as white and want to come together to advance the Alliance equity commitment and anti-racism work by building relationships, learning together, taking action, unpacking our whiteness. So we're really engaging in self-reflection and group reflection and leaning into hope. And you don't have to be in other committees to join this group. If this work is something you're interested in doing, we invite you to come, and you really can have an active role in co-creating this space. And if you want to say anything, Craig is in that space.
Yeah, I'll just put a plug for that. I've been part of that since the beginning. Lucina expertly facilitates and leads that group, and it's just a really important space to be thinking about how we as white folks show up in this work and what we can do to often be considering ourselves, our positionality, and the ways that we are moving through this work together. So the next one I think is coming up in a couple weeks. I will see you there. Hopefully we'll have more folks join us. And as Lucina says, you can have a really active role in helping to create what that space looks like because we're all kind of responsible for that work together. So Lucina doesn't have to do all of it, but does great work. So please join us.
Question in the chat, how can we sign up for the walk?
You can email me or Jen, and we will get you the information. Yeah, I'll make sure you copy.
Or if you wanna put your email in the chat too, we can also get that to you.
And then adjacent to the Alliance, Orbit, which is the sister organization to YSIPP, supports the existence of two lovely affinity spaces, which are the BIPOC caucus and the 2SL LGBTQIA group. And both of those groups have been meeting for a while. They are an affinity space. The members are using that space however feels best to them to be in community and to find like support and connection. And so if you are interested in joining either of those groups, you can email me or put your email in the chat with your interest, and we will make sure to link you up with them.
So as you heard, there are a lot of opportunities to get involved with our subcommittees, with the walk, with the affinity group. So we highly encourage, if you're not already connected to one of those, to become connected. We would appreciate your support and help, and like the work that we do is on all of us. So please feel free to join one of those if you are not already. The slides will go out after this with all of the information about those subcommittees, including the times, to make sure that works for your schedule.
Or join more than
Multiple, all of them, in fact. I attend 3 regularly myself, so see you there. Gordon, did you have a question?
Yes, I didn't get if the LGBT affinity group, did you mention that one? Okay, and then, so to be clear, now the equity group has become under Oregon open meeting law and on those rules.
the subcommittee.
Okay,
Just equity, the walk BIPOC and the 2S LGBTQIA are not, those are affinity spaces, so those,
Right.
yeah.
just,
Yeah.
that was new news.
Yeah.
Thanks.
Yeah. Okay. And now we'll pass it over to Lee.
Yeah.
Did you?
Yeah, so we're really excited to have Lee Stewart joining us. Lee will be sharing more about cannabis use in teens and how that is relevant to our work. Following Lee's presentation, we will go into breakout groups by subcommittee to talk about how, not by subcommittee, we will go into breakout rooms for you all to think about what we learned and how that overlaps with your personal professional work as well as your work with the Alliance. So stay tuned for that afterward. Yeah, and I'll hand it over to Lee.
And so am I sharing my screen already?
Yes.
Share.
Yeah.
Yep.
Good. Can you see that?
No, we cannot.
Okay, sorry.
Oh, there
How
we
about
go.
now? Great. Thank
Gotcha. Thank you.
Super. Well, thank you very much. Again, my name is Lee Stewart. I'm zooming in from Portland, and I really appreciate being invited to speak today. This came about because I reached out to the Suicide Alliance to see if people who work in suicide prevention are aware of the concerning association that's begun to emerge in research that links cannabis to suicide, particularly with youth and young adults. A little bit about me. I've been working in substance use prevention for about 5 years now, and these are some of the organizations I'm sort of loosely affiliated with and where I've learned a lot of what I'm going to speak to you about today. However, I will share that the bulk of my knowledge about today's topic comes from having a son with a cannabis use disorder, and I've seen firsthand the devastating impact of today's high potency THC cannabis can have on young people and their mental health. I'm not an expert in suicide, that's your guys' terrain, but I know enough to be aware that it is an extremely difficult, complex, multifaceted phenomenon that's likely different for each and every single person who contemplates it. Likewise, no doubt, all mind-altering substances can put people at risk for suicide. However, I don't believe there's enough awareness about cannabis as a potential risk factor, in large part because it's recently been engineered to be a very different product than the plant we legalized in Oregon in 2014. Because not everyone probably is that familiar with today's cannabis landscape, I'd like to start with a brief overview of what it's become and some of the very serious issues that have risen in the wake of commercialization. When you think about cannabis, you might think, I smoked when I was a kid, it turned out fine, it's really not that big a deal. However, cannabis has changed a lot in the last 10 years. The greatest marketplace change has been in the strength or potency of cannabis. Previously, THC, which stands for tetrahydrocannabinol, it's with the component of the plant that makes you high. Previously, it ranged around 4 to 7% THC. This was back in probably the 80s, 90s. But today, through cultivation techniques and genetic manipulation, the potency of cannabis flower increased to about 25 to 35% THC. In fact, most stores don't carry any low potency buds anymore. It's very difficult, in fact, to find things lower than 15 or 20%. Here's just an illustration, just a sort of a joint from the 1990s, averaged about 50 milligrams THC, whereas today, or in 2020, perhaps even higher today, it averaged about 200 milligrams, so 4 times as strong. Another big difference today is that THC can be extracted from the plant and concentrated to a potency over 90% THC. And this concentrate can be smoked in flavored vapes, in dab pens, there's special rigs. It can also be, added to food-like substances or sprinkled inside of a joint to make it stronger. And typically, concentrates are named after their appearance or texture. So on the screen here, you can see examples of something called wax or shatter, butter. There's also oils or crystals down here, which is almost 100% THC in this crystalline form that you have. Here is a graph just to visually illustrate some of how the potency has dramatically changed. It's really skyrocketed in the last 10 years, increasing about 800% since 2015, which is around the time that we first legalized it in Oregon. And unfortunately, according to data from NIDA, in 2021, adolescent use of high potency cannabis has surged in popularity. Among adolescents who use cannabis, concentrates are in fact the most popular form used today, mostly in the form of vaping. There was a large study of 8th, 10th, and 12th graders revealed that 72% of kids who use cannabis or have used cannabis used concentrates. And this study also revealed that concentrate users were more likely to go on to use other substances, and that heavy and frequent use is increasing. if you did use pot when you were younger, depending on your age, of course, it probably looked something like this joint on the left. But kids today encounter completely different products in their selection and the advertising landscape when using cannabis. Sorry, I'm trying to set my timer here, which I forgot to do. So you can see from this picture, compared to a joint, the back in Woodstock days was closer to 2 to 5% THC. Today, there's a vast range of products that are packaged in exciting labels and eye-catching images that are attractive to young people. You can see here on the right, these are vape cartridge packages that come in flavors like orange dreamsicle, watermelon splash, and then all sorts of other types of edibles and appealing things. And apparently it's not just kids who are also attracted to this new range of products, because a study published last year based on data from the US National Survey on Drug Use and Health showed that with commercialization, all use has increased. And it's estimated that about 61 million people in the US use cannabis. And for the first time ever, daily use of cannabis has surpassed alcohol, despite the fact that there's approximately 3 times as many people who drink alcohol than use cannabis. And a study commissioned by the OLCC shows that Oregonians actually use more cannabis than people in per capita than people in other states. And they estimate in this study that about 20% of Oregon users are daily users, which is also higher than in any other state. Daily use, unfortunately, is also associated with significant mental health and cognitive performance harms. No doubt, it's part of the surge in use is due not only to the sort of new flavored and candy-like products, but also to the rampant marketing and advertising campaigns that come with them. According to a 2023 study commissioned by the OLCC, this is the study I mentioned before previously, people ages 16 to 25 in Oregon see many more promotional messages than health-related ones. You can see here 47% health-related compared to 73% of promotional. And since we've been focusing on youth in this talk, I said the age is 16 to 25, but actually for adults over than that, especially middle-aged people, they see many fewer health-related. It's estimated closer to 30% because they're not getting their drug education in schools as many 16 to 25-year-olds are. Because of this messaging, it might explain, or the disparity in messaging, why, according to, again, data from the National Survey on Drug Use and Health, Oregon students ages 12 through 17 have the lowest perception of risk from cannabis in the United States, with 87%, again, this is 12 to 17-year-old Oregonians, perceive no great risk from smoking marijuana once a month. And here's just a study from Portland Public Schools showing that 27% of Portland high school students reported current use in 2021. There have been several studies recently that has shown that storefront availability of cannabis leads to increased use, which perhaps is not surprising. It's not only because there's greater availability, but also because of the advertisements, windows displays, the marketing, the promotional sales that we all see on billboards as we drive in and out of towns, really has served to normalize the use and convey the notion that it is safe. There are a couple of studies have shown similar things. These are 2 studies from Oregon that found that in towns with cannabis storefronts, adolescents had greater cannabis use, but also cannabis use with alcohol. a perceived cannabis availability, a lower perceived risk, and also a perceived parental approval. Perhaps because their parents are using it more, or they're just, in general, I think in terms of parents, there's also this idea that, you know, it's legal, it's safe, and certainly we've seen lots of messaging that suggests that also. There was recently a large study done through Kaiser Permanente in Northern California that looked at 100,000 kids in Northern California. And they found that when towns had less retail availability, such as no retail shops or storefronts, there was less adolescent use in those towns. And they also found that the further youth had to drive to a cannabis store, the less use was associated with that area. Again, there was an Oregon study that came out not long ago that showed that dispensaries located within a mile of a school impacted the use rates at that school. So if any of you live in dense cities such as Portland, you know that dispensaries are not located a mile away, but rather they're very close. Well, they're 1,000 feet to be specific. That's the rule that we have here in Oregon. They can't be closer than 1,000 feet. So why does this matter? Well, the Kaiser study went further than the Oregon study and found that the further youth had to drive to find a cannabis store, the less use was associated with that area, as we said before, but significantly, the prevalence of teen psychotic, anxiety, and depressive disorders and depression symptoms were also less in those towns. So clearly there's an impact on the mental health of these kids growing up with cannabis retail around them. So let's look into some of these mental health outcomes and delve into the consequences. Historically, most research on cannabis has only been done with low potency plants, but there's more and more data coming out now that includes today's high potency products. And scientists are finding that high potency cannabis, which they consider anything over 10%, as I said before, it's very hard to find anything below 15% THC these days. But that anything over 10% is associated with a greater risk of anxiety, dependency, thoughts of suicide, and psychotic symptoms. And these issues are especially prevalent in adolescents, perhaps no surprising since their brains are still developing. So let's look at some dependency data. Addiction to cannabis, which is a real thing, is called a cannabis use disorder, or CUD. It now has a medical diagnosis code in the DSM-5, and really it has the same criteria as other substance use disorders. Some of you are probably very familiar with this material, so I won't go through them, but there are usually 10 criteria that practitioners will assess a patient's use. And depending on how many they qualify, their use disorder is either mild or moderate or more severe. So some of these things, such as taking the substance in larger amounts for longer than you meant to, wanting to cut down but not being able to, becoming more fixated and cravings, and interfering essentially with your life, but yet not being able to stop. So just putting these up because there are people who still don't think that cannabis is addictive, but it actually has been diagnosed, and we have the same criteria as alcohol, opioids, and other addictive substances. And just like in the case with nicotine, now we have stronger nicotine vapes, which have been shown to be more addictive. That also applies for these stronger cannabis products, like the vapes that adolescents prefer or are drawn to. And the risk of addiction goes up too, particularly with young brains who are more vulnerable to addiction since their brains are still developing. And this is a study that showed that the risk of developing a cannabis addiction increases among youths who are using cannabis at least once a week, with the highest prevalence, of course, for daily users. And adolescents who use today, unfortunately, now do so more frequently, and many do use daily. And I personally would look to vapes. Vapes make it very easy for young people to use without adults around them being aware. They're very discreet, they don't have an odor, easy to conceal, and young people who are using a lot often just have their vape pens in their pockets and can use throughout the day at school without being detected. Here are just some more figures, again, from NIDA, the National Institute on Drug Abuse. They estimate that about 30% of people using marijuana, they're still calling it marijuana, have some degree of a use disorder, and how people under the age of 18 are 4 to 7 times more likely to develop a use disorder. It also has surpassed alcohol for young children, and they estimate around 19 million individuals in the US have a marijuana use disorder. That was in 2022, with 7 million of those under the age of 25. Psychosis is one of the most severe mental disorders that have been shown to be linked to cannabis. And there's a lot of scientific data now on cannabis use increasing the risk of having an acute psychotic break or developing long-term psychosis, such as schizophrenia. An important study published in The Lancet in 2019 analyzed 780 people ages 18 to 65 and found that use of high-potency THC, again, they were classified this as higher than 15% THC, increased the risk of psychosis 3 times, whereas daily use, again, of 15% or higher, increased the risk of psychosis 5 times. Whereas low potency, lower than 5% THC, again, this is more like Woodstock weed, very difficult to find today, had no associated risk for psychosis. So this is one of the reasons why psychosis is something that's relatively new, that's we're seeing in more alarming rates. In fact, there was another very important longitudinal study in Canada that was recently published. It looked at 11,363 young people aged 12 to 24 and concluded that youth between the ages of 12 and 19 who use cannabis, compared to those who did not, have an 11 times greater risk of developing a chronic psychotic disorder with today's products. Because of this disturbing data, Canadian authorities have recently updated their cannabis warnings just in March of 2025. And they now have rotating public health statements on cannabis packaging. So rotating, as I know cigarettes used to be that, like each packet might say a different warning that they rotate. But they say things that using cannabis before the age of 25 can have several serious consequences, such as affecting brain development and putting the user at risk for severe mental disorders, such as psychosis, schizophrenia, extreme paranoia, and addiction. Unfortunately, this has had very serious consequences for young people, especially. According to experts who recently spoke during a session at the American Academy of Child and Adolescent Psychiatry's annual meeting, there's mounting evidence that young people's use of cannabis is fueling depression and suicide. They cautioned, and I apologize for the tiny type, they cautioned that researchers are continuing to find that cannabis in all its forms is helping fuel the youth depression and suicide epidemic, and that psychiatrists have a role to play in assessing and treating cannabis use in countering disinformation. Colorado is ahead of us in Oregon in gathering information on cannabis use. And this shocking data is on completed teen suicides. Among 15 to 19-year-olds, marijuana is now the #1 substance found in toxicology results in completed suicides. It was present in 43% of teen suicides, which was almost double the amount or number of teens with alcohol in their blood. Similarly, California has begun to track some of this information, and suicide data from San Diego County shows that nearly 50% of all teen suicides included THC. And THC is the #1 drug found in completed suicides for people under the age of 25. Oregon does not track this number. But it's not just youth who are impacted. Several studies recently have shown associations of cannabis use with all suicide. One challenge has been sort of a chicken or the egg in terms of depression. So are people who are depressed turning to cannabis, or is cannabis making people depressed? So researchers in more recent studies have been trying to sort this out. This is a report from a European systematic review and meta-analysis that sought to assess the role of depression in the relationship between cannabis use and suicidal behaviors. They systematically reviewed existing literature. They screened 1,081 articles, and they found a significant association between cannabis use and suicide, even after controlling for depression. And they put forth 3 hypotheses that it could be people are using it to self-medicate, which makes their mental health issues worse. They could also lower the effectiveness of antidepressants. And this is another thing that's not well known, is that THC interferes with hundreds of different medications, such as antidepressants, such as Prozac, Lexapro. All the basic SSRIs are essentially 50% less effective if somebody is also using cannabis. So this is something, again, that therapists, psychiatrists, doctors need to be aware of if their patient is also using cannabis. And then a third hypothesis is that heavy cannabis use has been associated with increased impulsivity, which has also leads to a higher risk of cannabis. And they concluded that cannabis use should not only be seen as a possible risk factor of mental health disorders, but also as an independent risk factor of suicidal behaviors. This is another slide of an NIH study, and I apologize for these rather ugly slides. I've just screenshotted from my laptop. But this is an American study that also set out to explore the relationship of cannabis use and suicide. And they analyzed data from 2008 to 2009, again from NSDUD data for 11 years. And again, I apologize for the tiny type, but it was an analysis of survey data for more than 280,000 young adults ages 18 to 35 that showed that cannabis was associated with increased thoughts of suicide, suicide plan, and suicide attempt. And these associations remained regardless of whether someone was also experiencing depression. And the risks were greater for women than for men. The results of the study indicated that even people who use cannabis non-daily, and they estimated that as less than 300 days a year, were more likely to have suicidal ideation and to plan or attempt suicide than those who did not use the drug at all, regardless of whether somebody had been experiencing depression. So not surprisingly, this is highest among highest users, particularly those diagnosed with a cannabis use disorder. Now, this is a chart of their results, and you can see, you probably can't because it's tiny type, but what they did was they compared people with depression to those without depression, and they broke it into 4 categories of use, from not using at all to daily use, and to those with a cannabis use disorder, which is CUD on here. I'm going to zoom in a little bit to see if this can help you see a little bit. I'm not going to worry so much about the numbers. What I like about this is it's a visual illustration. First of all, they've broken it down into gender, women and men. Oh, I'm going over time. I'm almost done. And you can see for women, it is often higher for them. Those with a cannabis use disorder compared to those with none, this is with people with a major depression episode, are much more likely to commit suicide than those who not. And it goes dependent on use. So you can see they have a cannabis use disorder, but then also daily use, some use, but not daily, and none at all. And consistently through suicide ideation, suicide plan, and attempt, it's those who are using cannabis whose risk is highest. Oh, I can't advance without. Sorry, this is my last slide. And so I'll stop there. Well, excuse me, I think I just missed what was supposed to be. So the use consistency, but from the lead author from the study, the NIDA study, concluded by saying suicide is the leading cause of death among young adults in the United States. And the findings of this study offer important information that may help us reduce this risk. Depression and cannabis use disorder are treatable conditions, and cannabis use can be modified. Through better understanding the associations of different risk factors for suicidality, we hope to offer new targets for prevention and intervention in individuals that we know may be at high risk. And these findings underscore the importance of tailoring interventions in a way that takes sex and gender into account. So I'm going to end on this note of relative optimism that both depression and cannabis use disorder are treatable, as long as people are aware of the connection and the risks. This is a message I don't think is heard enough. I know from my own experience when my son was struggling, that we turned to pediatricians, coach, therapists. He even had 3 ER visits. And we're told it's just weed, all kids experiment, he'll outgrow it. But 5 years later, he's 21 now, he's still struggling. And quite frankly, we do worry for his life. So thank you very much for your time, for listening, and hopefully some of this information is helpful and relevant for all of your important work. Thank you, and I apologize for going over time.
Lee, thank you so much for that presentation, for being willing to visit us today, and yeah, all of the clear work that you have done. I know that we're looking forward to having you for a webinar later that will give you even more time and allows us to, the webinars allow us to really dive deep into various topics. So I'm excited to get that scheduled, and we'll share that with all of you. We wanted to go into breakout rooms for 10 minutes. I think Chris will help us with really just your reflections on the content that Lee shared, how this is relevant to your individual professional work as well as your work with the Alliance. Those clear connections between mental health outcomes and cannabis use for youth is something that we should all be thinking about, and really is why we were so excited that Lee could join us today. So I think as soon as Chris is ready, yeah, it looks like those are open, so we will be in there till 10:50, so 7 minutes. So see you all back here in 7 minutes.
And Lee, would you like me to add you to a breakout room as well?
Sure, I'd be happy to.
Awesome. Everyone should be back from breakout rooms now.
And to realize it's gotten that embedded in there, and I think that we definitely need to look at this.
Yep.
And I really think we need to look at the student health survey, which thank goodness the schools are required to do. Because that is revealing what's going on in those kids' lives in their school district. And for years, school districts have fought that because it brought a bad look on the school district.
Yeah.
And now I believe they have to do it.
Mhm.
And we pay attention to that because the kids are telling us
Yeah.
exactly what they're doing.
Thanks, Gordon. Welcome back, everyone. We have a couple minutes. I don't know if anyone wants to share from the conversations that you had in your breakout groups. Any insights, any reflections, any of the ways that this is particularly meaningful to your work?
Absolutely. Kirk Wolf, child psychiatrist. I think this was just a superb presentation. I really appreciate Dr. Stewart's efforts as well as sharing lived experience with her son. I would say that I'm definitely noticing start of school stressed, not only student absences but teaching positions absences. And so getting the word out is just so important. I would see our executive committee as really wanting to follow up on this and how do we get the message out to targeted audiences? Certainly youth and family being first and foremost, but schools as well as primary care. So I would definitely encourage us to put that on the executive committee agenda for next month.
And just so folks know, as far as like the subcommittees go, so Lee came to our lethal means safety subcommittee and talked about this within the last couple of months. And it was originally going to be a policy recommendation, but then we decided to make it a subcommittee project that will be like what's shared with multiple subcommittees, that we want to really dig into how to share, talking with youth and young adults around how they can kind of like hear this information, like how it can be shared with providers. And so we're going to be digging into a pretty deep project, and schools and workforce and transitions of care, I think, have already expressed interest. So we're going to be, Lethal Means will be kind of like heading that project around the teen cannabis use and what we can do with that. But other subcommittees will kind of be like joining us in that work too. So if folks are interested and want to be a part of that, there's lots of different avenues to be able to kind of join some of that. Lee, your hand is raised.
I just wanted to add, since I was getting cut off, but or I cut myself off, but the OHA is about to come out with updated health statements related to the medical marijuana program. And so those are due out by the end of the month. And I think those will emphasize a lot of these same points, and that will make it easier for other organizations to then, like all of you, spread that message because it will have the sort of official stamp from the OHA. But that's my hope.
Awesome. Well, thank you all for those comments. Thank you, Lee, again, so much. Here is the information about the upcoming webinar with Lee. There's a link that we'll put in the chat to be able to register for that. And we look forward to more conversation about this topic then. For now, I think we're going to move into a break. We will come back together at 11:05. So please take care of yourself, get some water, get a snack, and we'll see you in about 10 minutes.
Thank you, Chris.
Hi, everyone. Welcome back. Hopefully people are slowly trickling in. The next part of our agenda, we are going to work on or look at our policy recommendations to OHA for the 2027 legislative session. So as we mentioned earlier today, that part of the Alliance's role is to advise OHA on this work. And so part of that includes sending them policy recommendations or priority recommendation areas for the work that they will suggest through the 2027 legislative session. So we have recommendations from 3 of our subcommittees and then 1 that was submitted by an individual member. And so what we want to do is review all of those, have any conversation about them, and then we will come back and review each of them. We will vote on each of them individually. So Jen, I don't know if you want to welcome people from the subcommittees to share any context or answer any questions if needed, but I feel like we can just go through one by one.
Yeah, I think we can go through one by one with it. And the one thing that I will say about the recommendations is just that because the recommendations came from like some specific subcommittees, the hope is to see not necessarily to do like any wordsmithing right now, just because the subcommittees themselves are the ones that kind of like came up with those ideas, like from our subject matter experts. Not that you all aren't also subject matter experts. I'm not saying that. And just wanting to like honor the work and the direction and the hope from the subcommittees, and just really kind of like today is around seeing that those like kind of fall under what you feel like is the purview and the scope of the Alliance as a whole with that. So not necessarily like wordsmithing, but just like making sure that when we vote, if you vote yay or nay, that it falls like within the purview of the Alliance. And while we have these, we have to make sure that we still have a quorum because we have a lot less folks in the virtual space.
Okay.
So I can do that while we're talking through these.
Okay. Awesome. So the first set of recommendations that we have on the screen are for lethal means. What they suggest is OHA will work with the judicial branch to support and expand training on the ERPOs for law enforcement officials and relevant court system staff. Training on these protective orders would include how to request one, what this order covers, and other logistics. That the trainings would also be made available to the public. One of the other things that I think went through a previous legislative session and didn't move forward, multiple legislative sessions, and so is being suggested as a policy recommendation once again, is providing offsite storage for firearms in times of crisis at federally firearm licensees. There would be an offer of a waiver or a voucher system for people to access safe storage for free or low cost to increase the accessibility and lower the barriers in times of crisis, because cost is and has been an issue mentioned in the past, and that these can you speak to the last point?
I'm sorry, I was thinking about.
Oh, that's okay. This point right here.
Yes. Yeah, so our lethal means subcommittee would just kind of like put together ideas around like what education bullet points for this particular idea and policy recommendation for like why it's a good idea, like where it's working in the states that it's working in, just to kind of like give them some like talking points and different things in regards to that. So that was more kind of like a note from the subcommittee. Not necessarily part of the policy recommendation. So that's a Jen mistake. That shouldn't be there. So it's really just those first 2 bullet points around the ERPOs, the extreme risk protection orders, and then the storage for firearms.
Awesome.
With FFLs.
Yeah, I wonder if anyone from the lethal means subcommittee would want to say more that we might have missed, and or if there are any questions or discussion about these recommendations.
Yeah, if Kelly or Pam are in the room. I know Kelly, you said that you were sick, so totally okay, but you can't unmute and speak. Don't do that, you're sick. But yeah, if either of you have anything that you want to like put in the chat or kind of like share about these things. And it's okay if not.
No, you guys covered it.
Cool. Thank you, Pam.
So yeah, any questions, any discussion? Okay, cool. We will then go on to the next set of recommendations from the schools committee. I think there was some talk about clarifying language around training requirements. So the first is amending House Bill 2315 to read a school psychologist and a school counselor as defined by rule by the Teacher Standards and Practices Commission. And then also to sponsor a bill to create an Addis Act requirement for post-secondary education institutions with the same recommended updates for Addis Act, which will be on the next slide. So the previous slide was just saying creating for trade schools, colleges, universities, other post-secondary institutions, like an Addis Act like policy. So they are required to have suicide prevention, intervention, and postvention plans. And then there is some revisions to Addis Act that the schools committee is suggesting that you can read here. That's okay. Yeah, Annette?
I should remember this, but I don't. Can you remind us what HB, what the bill is that you'd be adding on to?
Yeah, so House Bill 2315 was one that the Alliance led. It was a long time effort that the Alliance was working on, and that requires behavioral health care providers to take continuing education units and suicide assessment. There's 3: assessment, screening, and management, I think. So it would basically just add an additional required profession to that list, which the schools subcommittee has found to be just a gap in that and want to be able to make sure is covered to be able to take those CEUs moving forward. Good
Yeah, so
question.
there was some clarification needed on
Yeah.
school counselors, school psychologists as being part of the list in the rule, which was the recommendation.
Great.
Yeah, and then just again on the screen, the revision to Addis Act. Yeah, that's okay. We're trying to figure out quorum at the same time, and but you all, I hope can read the suggestions on the slide. Are there any and these are the 2 slides, right, for the schools
Yeah,
committee?
yeah.
Would anyone on the schools committee like to unmute and share any additional context that we missed?
Yes, if Susie, because I know that the one about higher ed or like continuing ed, is from OCUSP, Oregon Campuses United for Suicide Prevention. So that was a big ask from them. And Susie or Graham, if either of you are still on, if either of you'd like to kind of talk to that need and where that's coming from, that would be really cool. It's okay if not too.
Hi, this is Susie. As far as I know, Graham's not here today. Yeah, so as Jen said, OCUSP is Oregon Campuses United for Suicide Prevention. And so our focus is on post-secondary schools in Oregon, which obviously hits the 18 to 24 age range for traditionally aged post-secondary students. And similar to K through 12, there's like a lack of coordinated effort across higher education institutions. And so that's what OCUSP's role is attempting to do. But we think that an Addis Act for post-secondary could be really helpful for schools to implement comprehensive plans on campuses. I don't know if there's any questions or anything else you'd like me to share.
This is Noel. I have a question.
Yeah.
The slide is Addis Act revision. What Susie's talking about would be a separate piece of legislation similar to Addis Act, but for post-secondary.
Correct.
So, okay, got it.
Yeah.
Thank you
Yeah,
for the
so
clarification.
that's the second bullet point.
Oh, my bad. I see it now.
No, you're fine, Noel. We had them on 2 separate slides. It's not at all straightforward. So that's yeah, no worries. Yeah,
and it's certainly there need to be some adaptations made from Addis Act and K through 12 to post-secondary institutions. And I see Caroline's question in the chat, and we also need to think about the differences between community colleges and four-year institutions and trade schools and things like that as well. Yeah, so like this one, what's currently up on your slide right here are some revisions that the school subcommittee thinks are important to make and kind of like do some adjustments to Addis Act as a whole. And then the second bullet point that Susie just spoke to would be adapting Addis Act and these for something for continuing education after like post K-12. So there's, those three different recommendations from schools.
Any other questions or conversation?
Just wondering, this is Jill from OJ. Wondering about if it would make, if this passes today, if we could make a, talk to the executive subcommittee or maybe the schools subcommittee about reaching out to Lon Staub, Addie's dad, who has been a previous member of the Alliance, just to engage and reach out and inform on how we talk about the potential legislative concepts. And whether it would be welcome to also have it named Addie's Act, or if it would be if there are other considerations to that.
I saw Lucina make a note to do that for Lucina is our staff for schools, so she made a note to be able to reach out.
Cool, awesome, thanks, Jill. Any other questions or comments on the schools committee recommendations? Okay, we will move on to workforce. So just one recommendation from workforce to have OHA provide funds for the creation and provision of relevant training for physical healthcare providers on suicide screening, assessment, and management. I don't know if anyone from workforce is present and would like to say more, or if there are any questions or discussion.
I can add a little bit of context in Annette, you can, or Linda or Angela too, from the virtual space, if either of you, any of you want to talk about this. Some interviews were kind of held with physical healthcare providers around just kind of having the same requirement like House Bill 2315, which we previously mentioned, requires those continuing education units for behavioral healthcare providers to take these types of trainings. And the idea is to also be able to have that requirement for physical healthcare providers, because as we know, a high percentage of folks see like their primary care doctor within a pretty relatively like close amount of time prior to an attempt. So like wanting just to be able to have people trained to be able to just figure out screening and assessment and kind of like what they can do to help support the person. And the general consensus, please correct me if I say anything wrong, Annette, is that physical healthcare providers see importance of the training and wanting it to be relevant to their field. So that way it's not like out of their scope. So like kind of wanting that if there is a training to be able to have it be relevant to the work that they do, it to fall within scope. And then also, there's another piece that my brain is not remembering, but like there's a desire and also like concerns around the requirement piece. And so this was an idea to have to kind of like start that process, to be able to have a training that's kind of like out there ready to go for folks, so that we can kind of like just slowly incrementally work on this requirement in a different type of way. Is there anything that you would like to add? And that you did a lot of work on this before transitioning to OFSM.
Just that there's a huge desire for more information around what to do around suicide, and at the same time, incredible resistance to anything being required. And I think what's tricky is that physical healthcare providers, that's such a broad category. And so adapting curriculum for specific settings is a lot of what we heard from the healthcare providers. And the other thing I think to really think about with this is that many of the big river trainings, the style they are is not really the way doctors and nurses are used to receiving information. That they are used to things being concise, to the point, this is what it means for your work. And so I think I think already Oregon Pediatric Society is doing some really good pull-out trainings now for pediatricians. And so looking at some of those kind of things, whether you do like case reviews or things that are more from a healthcare kind of viewpoint, I think could be really, really rich.
Thanks, Annette. Thank you.
Thanks. I appreciate that perspective. And I think we also need to keep in mind is that there are other peoples in healthcare offices that have direct contact with youth. that can play a critical role in looking for youth that are at risk for suicide. So I know we focus on the physical healthcare providers, but the people they work with in their office can also be part of the solution and probably have even greater time availability than the physical healthcare providers. Not that I'm not recommending that the healthcare providers be involved, but just recognizing, I can just say for myself, I had to take an 8-hour training just to get my DEA license renewed, 8 hours. And there are other requirements as well. So just being sensitive to that. And again, I appreciate the focus on a concise presentation as being an important part of this.
Thanks, Kurt. Any other questions or comments on this one? Okay, we will move on to the next. The next was submitted by an individual appointed member who wants to include the crisis text line anywhere that 90-day talk and 90-day text are shown in documents, printed materials, discussions, presentations, and state government websites. I invite the person who submitted this to share more if they would like, or to pose any questions or conversation about this one.
Yes, I would like to. Thank you so much. I appreciate it. The crisis text line 741-741, that used to be our leader, before 9-8 came along. And it was designed specifically for texters. And one of the things that it does that no other text line in the nation does is they use AI, which gives them the opportunity to analyze emojis and words on their impact on the kids. And the kids in crisis use a lot of emojis. There are 24 emojis that are more of a crisis to lead that conversation into that texting conversation, into an active rescue on that call, than using the texter using the word suicide. And the tear emoji, I'm sure you are probably aware of that. That is 6 times more active to show that that child at that point in time is in major crisis, and it encourages the counselor to shift over to the at-risk questions immediately without delay. And there's 24 of those that at least 24 that I had when I was researching. The other thing it does, on every single convo, the conversation goes to the AI. It's got 10 million previous convos on it from crisis text line, and analyzes that short convo and says, here's the next best question to ask. That it suggests to the counselor. The counselor can use that or go along and the way they were going, but that is data that is absolutely up to the minute, and versus all the research some counselors have in their heads and therapists have in their heads about how to talk about the issue. And also it triages the people that are online waiting to talk to somebody. So if somebody comes in an emergency and there's anybody up in front of them, they immediately go to the top of the list. We had this as the text line, and it is, I know because I talked with them a couple of weeks ago, that crisis text line is a backup for some of the state services. I'm asking it to be promoted in this way because it is difficult, at least in our county, for kids to find out how to get help, how to get crisis. I talk to medical providers down there every time I go to the doctor and every time I distribute their brochures, and some of them still don't know about 988, period. And it's, and the crisis text line is a piece that reaches the kids where they are, the way they communicate, and talks to them in their language, particularly around emojis. So that is my request. I know it's a big ask, and but I think we had, and I mentioned it to Jill, we had a 13-year-old girl this last month that came home and she was locked out of her house. And she did find a friend to stay with that night, but she couldn't figure out how to get help. And I want to find ways that kids that are in trouble right now don't have to go through a lot of searches on websites to get to a help for them. They get it quickly and get access quickly. The crisis text line, this is their research for last year, or for 2023. They do this report every year, and I attached it, and in Oregon, 61.5% of the text, the crisis text line, were youth under 25, and 57.6% of all age groups were LGBT. So they know a lot about it. It's a big subject. It's the major subject on their list, and I want to help kids.
Okay.
Thank you.
Thanks for sharing, Gordon. I wonder if there are any questions or conversations that folks have.
Gordon, can you share this with us, or do you have a PDF on those emojis?
Yes.
Do you have this as a PDF?
I have it.
Send out in the meeting.
The website at the bottom of that page, go to the next page, and on the bottom of it is the line to the piece that you've got in your hand, and everything, single one of those research pieces are there to get it. In there is the list to the emojis, and I wish I had it in there somewhere.
So yeah.
Oh, yeah.
Mary, we have
It's
it.
right there.
Yeah, we can, it'll go out with the meeting minutes
Yeah.
as well, and then Lucina's gonna put it in the chat for
Yeah.
you also, that way you have access to it now.
Yeah.
Hello?
Yes, Diane?
Yeah, hi. I'm Diane Kaufman, the founder director of the Hold On campaign. I put in the chat the link to the Hold On to Tomorrow music video. In that video, there's a diversity of youth images, and it's all about reaching out for help. And in the lyric, it specifically says calling 988. That's free to use, free of charge, and perhaps you can take a look at it and share it on your platforms.
Yeah.
Yeah, and I'll just comment, I think the information about emojis is so interesting. And I'm curious if 988 also is, because 988 also has a chat text line too, so. Yeah, and so I want to be just sure that we're getting information to young people. Here are options. And
Yeah, 988 does have text and chat available 24/7 anywhere in the US. That is responded to by a trained crisis counselor. I don't know the answer whether or not they can send emojis. I can't imagine that they can't send emojis because it's text, and so
That's all built into text, so my assumption is that it can, but I have never tried that.
They can get them, the
Yeah.
counselor can't read them to know how important they are.
Like
That's
they
the
can't see them?
They can see the tiers, but the counselor doesn't know what that means. And the crisis text line knows that that tells you, go to the suicide questions right now. Don't try to cool this person down. They are in crisis. And they've got that because they've tracked this with AI for ever since they started.
Well, I think it's the question of, are people with the emojis, are they trained to understand, you know, and that's kind of what you're getting to, is there enough training in that area around emojis and how to pursue further questioning and what, I don't know what's available for training around emojis.
And that's, we could always like follow up too with a question around that, cause I think just the use around 988 and like who the counts, like. I think that's a good question to ask too and follow up, so we can have that as a follow-up thing for us, just to kind of talk with them about, just to kind of see, cause it'd just be good to know.
Cause this question is, what policy recommendations does the Oregon Alliance to Prevent Suicide want to submit officially to OHA?
Yeah.
For consideration that OHA would take on, so so just framing the what we're talking about.
And with that too, before we kind of go into voting, I just wanna remind folks, just like kind of like with our membership recommendations, what we're submitting are just recommendations to OHA. It's up to OHA to kind of determine like what they are going to kind of take on and use as those policy priorities and what they're going to use in their different things. So these are it's a little bit different from kind of like what the Alliance kind of used to do before. But I'm sorry, you're fine. But it's we're just submitting recommendations for OHA consideration with different things.
Yeah, and I'd like to say that emojis change every day. And CTL tracks that because they know what's happening because they're seeing it click up on their convos. And so it's not something that we're gonna be able to train them, here's the emojis now, those emojis will change, you know? And so it's research in the moment that gives data to the counselor that they didn't have before the convo started.
Yeah. Well, I'll speak as a fellow appointed member, not as a vice chair. Like, I really agree with the spirit of your suggestion and your recommendation with this policy. I don't agree with suggesting just one resource. I think there are lots of resources out there. I think there are state resources that could be promoted. So just sharing that, like my disagreement with this recommendation is just saying CTL specifically. I think there are a lot of great resources out there. And Gordon, thank you for highlighting the like particular benefits of CTL and the AI components that it has. And I think, you know, there are lots of resources that could be suggested. So I just wanted to share that comment. That's just me, Craig, sharing that. With time considerations, are there any last questions or comments on the final recommendation around CTL?
There's an important one in the chat for people in the room to hear. Dean Carson says, for the record, crisis text line is a backup text line already for 988. Lines for Life and Northwest Human Services manage 988 text and chat directly and follow ongoing training. Just for and Avalon said they receive emojis on 988.
Sweet. So I think that we were talking about doing not a slate, but like a 1-by-1 vote for these different things to pass on as recommendations. So we were gonna go back to the beginning and really quickly before we do that, as a reminder, sorry for the clicking, y'all, to go through different slides. We do have quorum, we counted that up. We had two people count quorum just to confirm. So we have our quorum of members. To make a vote, an appointed member would make a motion, and again, we're gonna go by their recommendations, not like group by groups, like lethal means would be those two, and then schools, then workforce, and then the crisis one. So somebody would make a motion, we need a second, and then for folks virtually, we'll put your vote in the chat for yay or nay, and the room will be different. And then Lucina is tracking the in the room votes, and these are the people who can make a vote. If you all could just really quickly like either screenshot or just make sure that your name is on here, because I won't be able to have this slide up while we're going through the recommendations for a vote. So I'm just gonna leave this up for another like 5 seconds. just so you can confirm that you're a voting member. I think it's in 5 seconds, and then I'm gonna awkwardly scroll back to the first recommendation and 3 slides to
Are we,
1.
a question, are we gonna be voting like the lethal means
Yes.
group?
Yeah.
And then-
Yeah. So we'll do lethal means first.
So I think we're looking for a motion on the lethal means recommendations, policy recommendations for OHA.
I make a motion to as it's written for the lethal means related provision, again, as written.
I'll
Thank
second
you,
it.
Kirk. Sweet. Hannah Mary seconded. Thank you.
Awesome. So all in favor will you can put yay in the chat or say yay in the room. Yay.
Or nay.
Yay.
If,
Yay.
So, if you, and then, yeah, so if you approve, and then if you oppose, you can put nay in the chat or say nay in the room. And then any abstentions.
Who said yay in the room?
Okay, and that passes,
No,
majority
no.
passed.
No
No
nay.
nay, and no nay on.
Just a reminder, Craig, Kelly's reminding us that you can just ask if there are any objections and then you don't have to vote.
Right.
That's fine.
Okay, great.
The motion is second, any objections, and then we can, they can move forward by whatever that process that Kelly knows what it's called.
Okay,
Sweet. So now schools.
okay, so I can't see the chat from where I am. So Kelly suggests, do we need a motion
We
and
need a
then?
motion and a second, ask if there are any objections, and then it can pass by consensus if there are not. Otherwise, if there are any objections to one of them, then people can call for a vote.
Okay, cool. So we're looking for a motion on the schools committee policy recommendations.
I think it's a great provision. I recommend that we move forward with the schools related provision as it is written.
Second.
Thank you, Kirk. Awesome. Kirk motions and Susie seconds. So are there any objections to this motion?
Sweet. Oh, let me check the
Like,
chat.
the chat has.
Maybe count to 10.
Oh, nothing showed up in chat.
Okay, so there are no objections.
The motion passes.
Hearing none, the motion passes. We will figure this out one day. Today's not that day. All right. Okay, so we're moving on to the workforce policy recommendations. Would anyone like to motion?
If nobody else does, I recommend we make a move forward with the workforce training related provision as written.
Thank you,
Second.
Kirk.
Who is that?
Who seconded?
Stephanie. Willard.
Awesome. Thank you, Stephanie. All right, are there any objections on this motion?
Oh, chat. Perhaps. Nope.
All right, motion passes.
Yeah.
All right, and then our final policy recommendation, is there a motion?
Oh, is that?
If nobody,
Yeah.
oh, go ahead. Yeah, please
Yes.
do.
I would like to make a motion that, we follow this so that, people are informed that it is part of the 988 program that exists in Oregon at this time.
Okay, would anyone like to second?
I second.
Thank you, Mary. Are there any objections on this motion? I personally object to the motion.
What happened?
So
Kelly,
we'll
what happened?
call-
There's
So
no
we'll
chat.
call for a vote.
And we call for a vote.
Right, so all those in favor of this, can type yay or say yay in the room. Any abstentions or any opposed in the room, say nay. I'll say nay, you can also say nay in the chat. And then any abstentions.
Has everybody voted? We have only six yays out of six. Yeah,
Is it
passed by majority
of people who vote?
of people quorums, and we have 19 for quorum, so 6 would not be a majority for that.
So the motion does not pass.
Correct.
Okay.
Because there were abstentions and nays in the chat. I'm gonna break your pen if I keep playing about. So yes, this one does not pass at this present time.
Thank you all for the conversation, for the voting on these policy recommendations. The next step is to share those with OHA that passed, and then they, as Jen said, will make the decisions on how to move those forward within OHA for the 2027 legislative session. Great.
Just naming as a point of process, we'll respond to each of these
Individual
recommendations as well.
Cool. Sweet.
Okay. Great. I think that was the policy recommendations. So the next thing we are doing is handing over to Jill and Jonathan Rochelle for YSIPP updates.
All right.
And you should be able to share your screen, Jill.
Okay. How much time do we have?
We go till 12:30, so 12:25, so like math, 35, 40 minutes.
Okay. John, Michelle, you have been relegated to less than 10 minutes.
Okay, sounds good.
That is the official update on that sitch. I will share screen. I put a link in the chat earlier of a website that you will want later during this presentation. Including people in the room. If you are on a laptop, I would encourage you to log into the meeting so that you can have that link as well. Is that showing? Yeah, it is. Okay. All right. This is a co-presentation with Jonathan Rochelle from the University of Oregon Suicide Prevention Lab. That rapid fire voting, I would encourage all of you, if you're having any sort of regulation, lack of regulation, to take this opportunity to take a really big deep breath. We're all going to do that in the room too. Take a big deep breath. And if you wanted to make a noise and you let it out, you could. We are going to launch into statewide planning. Our hope for the day is to share some results of several pieces of analysis to give you an update on where the YSIPP 2630 is at, and to check in about whether or not we are on the right track. Here, if you're in the room and you wanted to pull something up via a QR code, you could, but note that the smart sheet that it brings you to is real grumpy on a phone only, so you will be able to see it, but it's not the best for accessibility. And then the link again to the YSIPP 2630 tracker is included in the chat. Just as a reminder, building a statewide plan for youth suicide prevention has many, many pieces and parts. That this is a process that we've been embarked on for over a year now collectively. That these are all the pieces that we and if you're in the room, mute your computer. You did it. You did it. No. Incompetent. And so we're not going to go over all of these pieces, but just know that the one thing that we're going to zoom in on today, which is the process of analyzing the start, stop, and continue, is the second there on that list. There are many, many more things and pieces that went into building the statewide plan. And with that, I'll pass it off to Jonathan Rochelle.
All right, thank you, Jill. so I can see a typo in the first slide already. It is not 2026 to 2020. And that should be 2030. So our lab worked with OHA over the summer to prep for the YSIPP, what we call YSIPP 3.0, but the next iteration. And we were analyzing feedback collected. And so kind of the general question that we were looking to answer is, where are we going with our work, and then how are we going to get there? And we operationalized those guiding questions into these 5 buckets. And so people were asked, what do you think the ideal of suicide prevention in Oregon would look like in 2030? What do we need to get there? What should we stop specifically? What should we start? And then what activities should we continue? And I'll blink twice for next slide. Okay, and so the methodology, how did we do this? So OHA reached out to participants across the state. We had 5 data sources that we collected information from based on those 5 questions. So that included the Alliance Executive Committee, attendees at the Oregon Suicide Prevention Conference, 9 tribes prevention staff, child and adolescent psychiatrists of Oregon work group, and then the Big River coordinators. And one of the things that we did, so we have a 32-page report on all of this where we kind of coalesced our findings. And so I'm going to be giving a brief overview. But one of the things that we did with that report is we color-coded each individual response in the themes that we identified. And so those colors that you see on your slide are a way, I'll share the link to the report, that you can go through and see the themes and see what specific data source was connected to each theme. And so one of the challenges was we had over 600 question responses to the questions. And so that gave us quite a bit of data to work with. And we selected 2 different methodologies to organize and analyze information. The first was a deductive approach, where we were mapping the ideal and need responses to specific pathways in the YSIPP. And then the second was the inductive. So that's kind of building from the ground up. And we use that to kind of go into the more minutia of the start, stop, and continue. So with the deductive findings, one of the major takeaways was that we had a wide distribution of individual responses mapping across all of the pathways. And we saw this as indicating a couple things. One was that there was a diversity of thoughts on the ideal and the areas of focus for that ideal. And then the other was that, the YSIPP was a kind of a comprehensive match to that feedback. And there were only really 5 pathways that did not have any feedback on either the need or the ideal. And so those were resource coalitions, clear links, protective policies, substance use services, and core competencies. I don't think there's major takeaways with that in terms of these aren't areas that we need to concentrate on. There could be a couple different explanations to the reason why a pathway didn't get feedback. One of the main ones, and we found this with the inductive analysis also, is that a lot of these pathways live very closely to each other. So you could find a clustering on one pathway that then would lead to other pathways not getting as much feedback. So we can go to the next slide. And so then with the loudest counts, right, for both need and for the need and ideal, the ideal got a little grayed out there. So with the needs, one of the ways that we were thinking about this is that the needs might point to what is needed to reach the ideal. But when we were looking at the different responses, we also found that they were interrelated. So the ideal also could be leading to what is needed to be focused on. And so we saw that with when you were looking at like coordinated organizations, which was very loud for like what the ideal would look like, that things like the appropriately trained community, representative trainers, involved leaders, directly kind of tied to that ideal piece. We also had, with the loudest ideals, information dissemination that was echoed in the inductive themes. We found that strategic scale up and dissemination of information were both heavily represented in the feedback. We also found culturally specific programming was, and then there was policy needs and appropriately trained community. And then a plethora of other pathways were identified with anywhere from 9 to 1 piece of feedback that corresponded. So what were the takeaways? We took all of this information, we were mapping it onto the pathway. One was that there was this wide distribution, that there was coverage of the YSIPP with the feedback. And so that indicates to some level the comprehensive nature of the pathways. I didn't mention, if a pathway was not a fit for a piece of feedback, then we would go up a level to the strategic goals. And if that was not a fit, then we would go all the way to pillars. So next steps, taking a bit of a closer look at what exactly we might be able to see in the meaning of, if a pathway did not have any feedback around it, what does it actually mean? And then same with the loudest. And then the other piece that we're excited about is, so right now with the process, it was really looking at, is there a pathway for that? When we were analyzing the feedback, is there a pathway that matches, that addresses that? But we were not able to get to the level of the degree to which the initiatives that live in that pathway are already addressing it, or if possibly a new initiative is needed. So that would be the next main step. Questions? I think we're skipping it, unless anyone wants to jump in. Okay, we're going to keep going. As I mentioned, so we've got quite a report that we'll be sharing with you, but this is just to give you kind of a sample of how the inductive worked. So we would first identify a theme, and then we would define it. And so this is for the start. One of the major themes was advancing equity and cultural responsiveness. We defined that theme as revolving around actions that promote inclusivity, cultural relevance, and equity in suicide prevention by centering historically excluded groups and integrating anti-racist, anti-oppressive approaches across initiatives and structures. And then after we defined that theme, we had sub-themes. So there were 19 total sub-themes. We would give counts for both of those. And then, as I mentioned, you actually will be able to see kind of the individual responses. So the raw data embedded within those themes and sub-themes, and then categorized by data source. So here was just a pulled out. I believe this was from the conference, and the specific input was provide culturally infused suicide prevention programs in schools. Then when you look to the right of that last slide, we have a bunch of counts. And so often when you're doing thematic analysis, you might not necessarily see quantitative analysis of it, so frequency counts. But we thought it was especially relevant here because the qualitative data were snippets, right? They were small responses. And there was also so much of it, so that based on that sample size of a large amount of responses, we were able to do these frequency counts and kind of see what was allowed and what was not. As I was mentioning before, with things living together, so the active dissemination and expansion was the loudest for the start overall themes. But then the two ones that had the least amount, so cross sector collaboration and integration, and then internal infrastructure and capacity, lived very closely to that theme. And so that kind of explains why those might have been a little bit quieter than the loudest one. So one of the things that we were not intentionally trying to do was have a certain number of themes for each start, stop, and continue, but we actually landed on 6 themes for start, 6 themes for stop, and 6 themes for continue. So 18 total themes. And what we were also not intending to find was a harmony across the start, stop, and continue themes. And so what we ended up finding was that start and continue were very similar. And then the stop theme could also often be matched to those 2 themes, and it would be the opposite. So it would be the converse of that. So an example of that was one of the themes for start was advancing equity and cultural responsiveness. The continue was very similar, so it was inclusive leadership and representation. And then the stop was the converse of that, which was stopping white-centered systems and exclusionary norms. And so then what we ended up doing was creating an overarching table that showed that cross-theme relationship. And so that would be the next slide. And so on this table, you can see kind of a mapping of all of the themes, the relationship to each other, and then how loud those themes were. And so it starts with the domain. And so we ended up 4 themes that related to each other, creating a domain. And so we had 6. We had health, equity, and representation, youth leadership and engagement, collaboration and system integration, strategic expansion, community engagement and cultural relevance, and then systems capacity and sustainability. And then within each of those domains, you can kind of walk through the start and the continue, and then see that there was kind of this converse with a stop, which we found to be reaffirming of the themes, that there was kind of this relationship across the information of the start and continue relating, and the stop being the converse of that. In the middle, you'll see that the delaying action and responding with silence was italicized. That was because this one did not fit as well as the other strings. We kind of made the argument that it could fit as a converse in the collaboration and systems integration, but it wasn't as explicitly tied as with the other ones. I think we can go to the next slide.
Just a second, Tom. Sorry.
Sorry, we were muted in the room. I was talking back at you just then. One thing that this says to me is that the things that we like, and John J.R. just said this, but in like the things that we should stop doing are the opposite of the things that we should start doing and continue doing. And the 2 pieces of feedback about what should we start doing and what should we continue doing were almost exactly the same. So start and continue were nearly identical, and they were all kind of the opposite of stop, which was interesting. That's it.
Yep, thank you. This was just for any data nerds out there. This was interesting to me because it kind of showed the internal distribution of where you had kind of in an overall domain like health equity, where we had a concentration on naming the start versus the continue, and then how much of an emphasis was there on stopping those key things so that the starting and continue could be successful. And then kind of going back to what Jill had said, I don't know if I have it in this slide. Oh yeah. So often when you're doing kind of an analysis like this, you have the things that are on the page, and then you have the things that you find that you weren't looking for or intending. And so on the page, we had the loudness of the strategic expansion and dissemination. So getting the information out there, doing that in a thoughtful, strategic manner. But one of the interesting things that was echoed by that was, as Jill had just mentioned, you know, this sameness between the start and continue themes. And so there's a couple different explanations for that. One is like within a theme or domain, people might be suggesting to start things that aren't being continued, that aren't already being done. Another one that we were finding that's related to that strategic dissemination idea is that people were suggesting things to start that have already been started, that are actually a continue. And so that reinforces the idea of making sure that people know what has been started and what that difference is between the start and continue, that many of the things that are suggested to be start are actually continues. And so then another piece that I found interesting is when you have something like the YSIPP that is so expansive, and we're going to be jumping into a scavenger hunt, looking at pathways, right? You have so many different levels of areas. I thought that the 6 domains that were kind of identified were a complementary piece to that, kind of a simple way of chunking these pieces of feedback up. And then I think the last piece was mapping the themes and sub-themes underway. So we're kind of going back to the deductive analysis to complement the inductive and looking at where the themes and sub-themes that we identified are being addressed with the YSIPP already, and then to what degree based on the initiatives and how the initiatives are going. So all right, I don't know if I did that in 10 minutes. Here's our nice UO themed QR code that's going to take you to the, I don't know why I keep emphasizing 32 page, maybe because it's extensive, 32 page report.
How many pages?
Yeah. And it also has my email in there, and I will field any questions that you may have. And with that, I think I'm done. I don't know if I made that in 10 minutes.
All
Oh,
right, you. So just as a piece of information, and for especially subcommittee participants and chairs to hear, this is our plan to go back and double check our work. So we went through and did the theming and chewed on it and analyzed it. But as J-Ro said, we didn't double check then to see these pieces. So I will go through and assign those themes and domains that J-Ro talked about to each YSIPP 2630 initiative. So all the things that we have planned over the next 5 years, to see if, to the degree that people said it was important, to what degree are we addressing it in the YSIPP itself. So that's a double check. When I have done that, I will ask the Alliance subcommittees to check relevant initiatives by themes. So I will do the homework for you and present it and ask you, does this seem like enough in this section or not? So I am asking for permission, especially from committee chairs, to be able to take up committee time to do that. That will probably be 4 or 5, maybe 6 months from now, to be completely honest. And then the University of Oregon Suicide Prevention Lab is going to go back through those 600 pieces of feedback and check to see what is not included in the YSIPP 2630 initiatives. Specifically, if somebody had an idea or a piece of feedback that was really, really specific, that doesn't seem to show up in the YSIPP 2630. So not just by theme, but very specifically. And that is important because this is part of our common practice. Every year we do a start, stop, and continue process wherein we look at our bookshelf ideas, the things that aren't included because we said we didn't have bandwidth or funding, or it wasn't the next right step, or that wasn't the next right time. And so we want to make sure that any feedback that came through in the development of the YSIPP 2630 is added to that bookshelf list that already exists that we look at anyway. So that's the loop back to double check with the work on the feedback analysis piece. But what's in the YSIPP 2630, you ask? I'm so glad you did. Let me tell you. You'll find it is all embedded in a culturally infused Oregon suicide prevention framework. The initiatives, line by line, went through with Dr. Joyce Chu to look to see what culturally infused language needed to be added to initiatives. You will find in that smart sheet link on the YSIPP 2630 tracker representation from youth serving state agencies. You will find goals and initiatives that were directly created from Big River coordinators, other key initiative leaders, you all as the Oregon Alliance to Prevent Suicide, the work that is led by OHA, our 6-person OHA suicide prevention team, Deb, Megan, Taylor, Jill, Shanda, Roger. And you will find it is excellent, but it is not perfect. That there are it is the best one that we've had. I feel confident of that. It's so good. And it is not perfect. And so if you see a thing that is an imperfection, please do share it so that we can address what is not exactly correct. What is not in the YSIPP 2630 is that that list of bookshelf ideas, the things that didn't make it, because we can do anything, but we cannot do everything. So anything in that vein remains on the bookshelf ideas list. Just by some numbers, there are over the next 5 years, starting January 1, 2026, there are 342 initiatives listed in the YSIPP 2630. 102 of those are in the green section that address upstream primary prevention. 125 of those are in the yellow section for prevention and early intervention. Some would call that tier 2. And 82 of those initiatives show up in the intervention, treatment, and postvention section of the YSIPP, or the orange section. 33 specific initiatives live in the blue section down there at the bottom of the YSIPP 2630 tracker for addressing anything that is categorized as our centering lenses or foundations. So this is policy, funding, equity, trauma-informed practices, those types of things. And that number 33 is misleading because those 33 are only in the blue section. So I gave a couple other number examples for things like equity, which is one of our centering lenses. And there are some equity specific initiatives listed in the YSIPP 2630 tracker. But there are also equity considerations in 96 of those other in the green, yellow, and orange section. So just naming that it's not that we are only for our foundation and the things that we are centering through, that 33 just means that they only fit in that category. They didn't also fit in like a Big River initiative or something like that. Okay. When the YSIPP 2630 is published, where it will be a PDF, I don't know how many pages, J-Ro, it will be, but my guess is 80 is normal. In it, you will find something I'm calling the YSIPP 2630 simple view. This because nobody can digest 342 things at one time, or ever. And so we created kind of more files in the filing cabinet so that so that you can see it in a kind of more condensed view. And so heretofore, when we talk about the YSIPP 2630 simple view, it's bigger, broader categories, and it isn't the nitty gritty, all of those 342 initiatives. So things like these 3 here that are listed, things like we're going to have contact information for key partners that is updated and accessible. We're going to have regular, organized, responsive meetings to coordinate and collaborate on the work. We are going to nurture and expand new partnerships and relationships. So if you see this green arrow here on the slide, you can see on that in the smart sheet itself, there are whatever 25 minus 4, 19, 21 things in that section hidden, which you can find by the second green arrow there by expanding the plus sign. So if you're like, what regular, organized, responsive meetings are we prioritizing? you can find those by expanding it and seeing things like Big River coordinators meet. OHA hosts SPIP meetings. There's regularly coordinated meetings that happen between ODE and OHA and ESDs, this type of thing. So you can make the YSIPP more digestible by keeping it in the simple view. And naming that when the YSIPP is printed, that simple view is still 9 pages long. And that is what we will refer to kind of big broadly over about like what is the YSIPP 2630? It's that higher level of filing in the filing cabinet. Does that make sense? People in the room are nodding. People online, can somebody like Noel is nodding? Okay. Roger is kind of nodding, but also trying to drum up a plumbing emergency. Okay. And then just noting that that if anywhere you see a plus sign on that smart sheet, there's something more there. And so anything past 5 numbers long isn't included in the initiatives list because it's more of like a workflow underneath of it. So there are a few places where there are in the numbering sequence, there are 6 numbers in the filing cabinet. Why did I do that? Why did I make a new filing system? Well, because that's the YSIPP 2630 simple view level of the filing cabinet will likely not change over the course of the 5 years. Everything that we are prioritizing and doing underneath of it is fair game when we do start, stop, and continue each year. But that allows us to say, this is the YSIPP 2630 plan. I think that simple view, the level of organization in the strategies level will be more applicable for counties and local coalitions. So if you are doing work at the county level or with a suicide prevention coalition, I think it will make sense to you if you're trying to do strategic planning to say, we need regular meetings to organize. We need to develop new partnerships. Those activities I think will be more applicable for not just statewide plans. And it makes the statewide plan more digestible. In a minute, oh dear, okay. I don't know if we're gonna have time for the scavenger hunt. Oh no, all right, I'm gonna give it up. Let me show you a few things. It is important to me that you all, the collective us, know how to filter this smart sheet because it answers really important questions like what is OHA doing for 18 to 24-year-olds? What is OHA doing that is equity centered? What is ODE doing, end of sentence, for suicide prevention? And so the filtering options in the smart sheet allow us to have this other feature that I'm pitching that we call My YSIPP. So who has a My YSIPP? Well, all the youth serving state agencies do. The Oregon Alliance to Prevent Suicide has a filterable list of what your YSIPP is. And so I'm going to show you that here in a second. There are 3 ways to find things in this massive, almost 500-line document. I have preloaded filter options for you, which I'm going to show you how to do here in a second. You can filter by any column, by any label that's in that column. I'll show you that. And you can also use Control F if you're looking for the Hope Institute, for example, you can just Control F and write in Hope Institute and it will show you where that shows up in the, so if you're looking for a specific word or person or initiative that you know the name of, you can do it that way too. Okay, so if you have 2 screens and the ability to follow along here on your smart sheet, at the very top of the smart sheet, you can filter by any column. So there's 3 little dots there on the edge of each column. I'm choosing to show you the YSIPP 2630 column itself. And then there is an option for you to filter. I have more options showing on my screen than you will. I think you'll have like a couple options to see. When you click on that, it'll show a list of all of the things, all of the content that's in that column. And so here's an example of sometimes people have asked me like, what's not going well? What's not on track? You can answer that question with this smart sheet by asking that column to show status update, which is highlighted there. And then enter in the value, checking the box not in good standing or not complete. And when you do that, when you ask what is the status that matches with not in good standing and not complete, you will find the list of the 7 specific initiatives that are out of compliance, that we are not on track, something has gone off the rails, and or OHA hasn't done what OHA said they would do. Hashtag caring contacts. The other thing to know about this is that this that far left arrow there allows you to include the parent row. A parent row, when you can, so clicking it makes it have more content loaded, makes it messier, but you can see where it fits when you click to include the parent row. And so depending on if that's what you want to find, to know, like, I don't want to just know the initiatives that are on track. I want to know where they land in the OHA suicide prevention, the Oregon Suicide Prevention Framework, or the YSIPP itself. Or if it's a big question that you're asking, like what is everything ODE is doing? I keep using ODE, Noel, please still be my friend. You might not want the parent rows because it makes the document a lot bigger, because everything that it's nestled under shows up when you click that. I have another one here. How do I know it's new? So here I'm going to show you the preloaded filters I've made. At the top of the, I think I'm going to make a video explaining all of this too. I just decided in this moment. At the top of the smart sheet, the top row, there's a filter option. So if you click on that little down arrow that the green arrow is pointing to here on your screen, you can see all of the things that I've already preloaded for you, so you don't have to know anything other than clicking that filter. Including, I made one for what is new in the YSIPP 2630, just as a which shows you there. And so if you click that filter option, then the only thing showing up in your smart sheet view will be what is new. To get it off, you click that down arrow again and say filter off. So this is how you can know what the Alliance YSIPP is. You'll see the Alliance there as an option for filtering. This is how you can know what is the specific around 18 to 24-year-olds, evaluation, all of the state agencies. If there's a filter that you want me to create on my end for a relevant thing, I'm happy to receive that request and build one for us. And the goal of this is so that you can answer the questions like, because these questions come in all the time. And we are not going to do this next section because we've run out of time. So all of that to say, the YSIPP 2630 tracker is right now, in this very moment, available for you to peruse and to find out what got included, what didn't get included. I tried to build in ways for you to be able to filter it and know if there's a specific thing that you're looking for. And just know when the printed, published YSIPP 2630 comes out, that simple view of just the 4 numbered categories, which are the strategies, will be, you can print it, you can, frame it, you can put it by your bedside. And that will be what we all at OHA will refer to as the YSIPP 2630 will be that level of view. Because as no one can digest 342 things that we are doing. I will note that the 342 is a huge number. It is literally what we think we have bandwidth to do. It's not aspirational, it's a plan. So part of the reason why it exploded so much is because we asked Big River coordinators, what are you going to do in the next 5 years? We asked you all as the Oregon Alliance to Prevent Suicide, what do you want to do over the next 5 years? And so anything that felt aspirational and not able to fit into the ease impact analysis is not included. It is a strategic plan, not an aspirational plan. That was too much. I'll make a video. It's good. Let me know if you have questions. Are there any questions right now? What? We're not doing scavenger hunt. We don't have time.
Would you still like everybody to kind of go into breakout rooms for a
No.
little? No.
You had prizes? I'm concerned about.
I
Is there a
did.
way you can still get those prizes?
Okay,
Or- Not.
let me noodle on that. I had a scavenger hunt prepared for us so that you could answer some questions in practice in the smart sheet. I had prizes. I have prizes for people. I will consider that and come back to you. It will need to be at a future time. This concludes my presentation.
Thank you so much, Jill. I'm excited to add a framed thing to my bedside table
Oh,
because
good.
it's in need of that. So I think the YSIPP is the answer.
Yeah.
Yeah, I think unless there are no other things for the group, I'll just a couple reminders from the course of our time together today. Thank you all for being here. Register for the December quarterly meeting as well as the 2026 quarterly meeting. Register for Lee's webinar on cannabis use and teens that is coming up in early October. There were other things that I'm now join a subcommittee, join multiple subcommittees, come to the walk group, join an affinity group if you are members of those communities. We are so excited to have more of you in our subcommittees. Thank you to the subcommittees and others for the policy recommendations. Thank you all for everything that you do. Thank you, Jill, for your presentation. Thank you, Jonathan Rochelle, for your part of that presentation as well. Jill has reminded me that we need to give a minute for public comment.
You just have to call for it.
Yeah, if there's any additional public comment, input.
Okay, so
Great.
I get to be a public comment person now. Hi, this is Annette Marcus. And I just want to speak, just raise up again what got spoken to briefly in that when Lucina was talking about the equity group, which is the level of attack that the trans community in particular is under, and folks who look brown or black right now are under, and I just am really, I guess I'm just really hoping that we as a state can come up with messaging around we're there, we got you, we love you, we're happy you're here, your existence matters, we want you on the planet. And yeah, I don't have the perfect answer for it, but I just am aware that there's just so much pain in those communities in particular.
Thank you so much, Annette.
That is something that we've talked about as an alliance in the past around how to when and how to speak to the different current events that are going on. And I think that this is definitely equity meets soon, equity meets soon. The fourth week, so we can totally, I think, bring this up there as well, and then also to like bring it to our executive to see like how, so I agree. I think that makes a lot of sense for us to be able to put something just to speak to that as well as we can. And then also to even with that, seeing how we can make a recommendation to OHA. I know that we sent a letter like thanking them for their statement that was put out. So doing like a letter and like another like recommendation around that, I think totally makes sense and fits with the alliance and what we do.
Yeah, and I'll just add that there has been a lot of conversation as well. I mean, supporting the 2S LGBT community right now and to our Spanish speaking Latin community members, especially migrant and immigrant populations right now, and that we really want to be centering their needs in this moment. And if that is something that you want to like dig deep into and talk about how we can be doing as an alliance, please do come to the equity subcommittee.
And Chris just put in the chat as well that just this morning there's news that there's a potential federal movement to label trans advocacy as domestic terrorism. So justice, because if anything can't get worse, so that's something for us to kind of just like think about as we move forward and how we can support folks. And with being an advisory group to OHA, I think kind of seeing how we can come from things like from that suicide prevention lens, which it totally is. It's not, so just how we can do that and provide support and how we can be a resource to folks as things just continue to go where they're gonna go. So a deep breath for everybody, deep breath. I don't know what I just said. I think it's a deep breath, but deep breath. It's a lot.
And just I think to close on a hopeful note that we have a really beautiful community here of people with a lot of lived experience and just a lot of passion and care. And doing this work is hard and heavy, and doing it together is much easier. So we're really grateful that our state has such an incredible group of people who keep showing up. So thank you for showing up, and yeah, we're in this together. Let's lean on each other and Mateo. Yeah, let's
Could we please get Mateo pinned? Oh, I didn't need to unmute. Jeez.
Oh,
Oh my
Hi, Jordan.
Thank you all so much. For folks in the room, lunch is upstairs to the left. Is that left to that direction? Free bag lunch. For folks at home, I hope you are able to eat
Something delicious.
yet. And yeah, thank you all so much for being here. Thank you, Craig.
Yep.
Thank you, everybody.
See you all in December. Thank you.
Bye, everyone.
Thank you for putting the